Dick is here, but you know what the others are here for then?
I do not.
Coronavirus today,
Okay.
and I get tested
I do.
tomorrow,
Adam,
but I have no
that's
symptoms.
Adam and Amanda.
so
They're here to do the
I'll let you
presentation
know
on
if something comes
the
up,
jail
but
reentry program.
I had a close contact Thursday evening, so that's why I'm remote, so that doesn't affect me.
That's why I'm here.
So they are
Not
here
there.
for,
Consultation?
nope,
Report
number
from the-
6. Yep,
Report from the Reentry Coalition.
yep.
Okay.
And then otherwise they do not.
The ones on the back wall though aren't.
Yes, that's Adam and Amanda. They are
Okay.
here to do the report. Yep, the
Okay.
other two I don't know.
All right. Okay, now we got Karen and Diane here now. Yeah. Hi. Wait 1 minute here for Dora to come back.
Deb's not very patient, is she?
Pardon?
Deb, we're struggling
If there's
hearing
guests in the
you.
audience, we could introduce ourselves if that would help.
Jeannie or Nicole or Stacy, can one of you talk? I don't know if it's just Deb or if it's all of you.
Hello, this is Stacy.
Stacy's
Hello,
nice
this is
and loud.
Jeannie.
Deb,
Can you guys hear me?
we can hear Jeannie.
I can hear everybody. This is Sally.
Not
Can you
very-
hear me?
Are you hearing her very good? You hear Jeannie very good? Can you
We
speak,
can hear
Jeannie?
each other, we can hear each other online, I just don't know if you guys can hear us.
Yeah, I can hear all of the
Okay,
people.
all right, now I hear you, okay.
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 Should we? Yeah,
We can probably get started.
pardon?
We can probably get started.
Yeah, that's what I think. Okay.
Erica, did you hear the part where I said if we have guests, we could do introductions?
I didn't, but now I did. So yeah,
Okay.
we'll let Kurt call the meeting to order and then we'll do introductions.
Okay. Call the meeting to order and certify that the open meeting law requirements have been met and adoption of the agenda. Any questions on the agenda?
I'll move to adopt the agenda.
Jeannie and Bridget? Okay. Motion to approve and seconded, and all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay, carried. And then we'll go on to the minutes of prior Human Services Board meetings, August 23rd and December 13th. Everybody had their minutes and read them, and any questions?
I have no questions. I'll make a motion to approve.
Motion by Jeannie. Second by Diane. Okay, all those in favor of the minutes signify by saying aye.
Aye.
Opposed, same sign. Okay, carried.
Do introductions.
Going to the introduction.
So yeah, I think we'll do introductions quick since we have some other people in the room today doing reports, so everyone knows who everybody is. And we also have some people remote. So I will start and then Kurt, maybe we'll go to you. I am Erica Anderson, Deputy Director for Human Services.
Kurt Scoyen, County Board, and I am the Chair of the Human Services.
Sammy Becker. My first one. Sammy Becker, Administrative Specialist for the ADRC.
Sam Tetzloff, Administrative Specialist for Human Services.
Dorjean Blaha, and I'm on the board.
Melissa Youngbauer, ADRC Supervisor.
Victoria Pearson, Fiscal Manager for Human Services.
Karen Sepich, Board Member.
Bridget Turner, County Board.
Okay, thank you.
Deb, do you
And-
want to go for on the remote end?
I'm Deb Sukla, I'm the Human Services Director, and I'm trying this meeting remote for a change. I'll turn it over to Jeannie.
Jeannie Nutter, County Board Supervisor, Vice Chair of this committee.
Sally?
Sally Miller, County Board Supervisor from District 3.
And Nicole, and then Stacy.
Nicole Millerin, I'm the consultant from Brave Spaces Counseling and Wellness.
And I'm Stacy Shapiro with Shapiro Strategies Consulting as well.
Thank you.
Okay, thank you. Okay. And then we go on to number 5, the consultation update.
So I'll turn this over to Nicole and Stacy.
I'll go first. So I continue to have consultations with both individual staff and as groups. And since my last report to the Human Services Board, I continue to do repair meetings with sets of people, 2 people, staff, or whomever it might be, working on repairing relationships and talking about challenges and having crucial conversations. So continuing to facilitate crucial conversations so that those crucial conversations will continue as part of practice. And then I've also been able to continue my observation and guidance with the leadership team, and I'm really pleased on the changes that they have made, and internally the feedback from them on what that's like for them individually and as a whole, that since they've been making those changes. And as I did in my report, my next training that I hope Human Service Board members and County Board members also attend, my one day will be on Tuesday, February 15th, and then I'll just do a short 1 hour on MLK Day. Any questions for me?
The 1 hour for the Martin Luther King. The 1 hour for the Martin Luther King Day is for the all staff, county-wide staff. So I know Jeannie's talked about wanting to get this out more to the county-wide efforts. And so this will be a good introduction for that. So hopefully that leads to bigger and better things, but at least a good start.
Yeah. I just have a question for Nicole. The training, and I hear an echo. The training on the 15th, is that similar to the one that you did in October and December, or is it different?
No, this is a new one.
Oh, okay.
So this is diving deeper into practice.
Diving deeper into what?
Practice.
Oh, okay, great.
Yeah, there might be too many people with their mics on. Maybe that's why we're having mute issues. Are there questions for me regarding the work that I've done thus far, the work that I have ahead of me, or anything else that you wonder about regarding my involvement?
I guess that means it's Stacy's turn.
All right. Hello, everyone. Good afternoon. Good to be here again. And I'm hearing the echo too. I hope you aren't. But I've thoroughly enjoyed working with Deb and the Human Services staff, and I just got 3 quick updates for today. I continue to meet with Deb on a weekly basis, just covering leadership and moving forward with the staff. I will also be meeting one last time with the leadership team in the next few weeks, and my 3rd and final training will be coming up here in January. It's titled Striving for Excellence, and it will be on Thursday, January 20th from 9 to noon virtually. And you're all invited, and I'm excited about it. It seemed like a fitting title because at the last staff meeting, when we trained together, the department changed the term of high performance culture to service standards guiding the culture of excellence. So I thought I would continue with that theme. And if you recall, 100% of the staff agreed to this change and shared many thoughts as to how it was the right fit. So you're all invited to that. You will receive an email invite as well, and I'll continue to meet with Deb until I've accomplished all I've offered in my proposal. And wondering if you have any questions. If you'd like to hear me say it twice again.
I just put a message out on chat, and I don't know if anybody read it, but if maybe Sam or somebody could run into the TV station to see if they, because it's really hard to understand what people are saying.
Sam's gonna get one of the IT guys.
Okay, great, thanks.
Yeah, we're having trouble. You guys are a little hard to hear, and then for yourselves, you're echoing.
Yeah, we hear ourselves twice.
Right.
Looks like they turned up the volume on us instead of the other end.
So if no questions, thank you for having me.
Thank you, Nicole and Stacy. I enjoy
Thank you,
working with
guys.
both of you, and it's making a difference. We can feel a momentum in our department, so thank you.
Awesome.
This is Sally, Stacy and Nicole. I want to thank you guys for coming in. I knew when I recommended to Deb that this would be really beneficial, and I'm thrilled to find out that it's going countywide. I know the work that you guys have done with other agencies I've been involved with, and you are exceeding my expectations. Thank you.
Awesome. Thank you, Sally.
Well, it's a day of just,
That one don't work either.
of course mine does.
Well, I think we can move on to the Reentry Coalition, and while they work on our end, because we'll just be listening to most of that, I think.
Oh, okay.
All right. Goodbye, everybody.
Okay.
Okay. One person
Thank you,
on that
guys.
end. So Adam and you guys can come on up. Just to give everyone an update, it sounds like the soundboard locked up in IT, so that we are having some technical difficulties. So please just bear with us.
Would you like us to be up here in the crowd? Doesn't matter.
Whatever you're most comfortable with, I think is fine. Up there, of course, then people on TV will be able to hear you better. Or you can pick a seat at any one of the seats that might be working.
Yours is probably the only one working.
I know, mine's the only one working. Lucky me. You can come sit by me, Adam, and I'll just put my mask on. Yeah, absolutely. I'll make some space. That's okay.
All right. Hello, everyone. It's nice to see some of you again, maybe meet some of you for the first time. My name is Adam Trunzo. I'm a youth and families educator with the University of Wisconsin Extension Office right upstairs. Extension is a part of the UW system, and the idea is we bring the resources of the university to every corner of the state, and one of those is Whitehall and everywhere in Trempealeau County. And then I'm also joined by...
My name is Amanda Heggie, and I'm the library director at the Whitehall Public Library.
And so, as it kind of mentions on the agenda, we're here because we're members of the Trempealeau County Reentry Coalition. Several years ago now, between my work and Amanda's work, we noticed that there was a very significant gap in what people had available to them when they left the jail here in Trempealeau County. Sometimes they'd be released in the summer, or they'd be released in the winter with their summer clothes and in a garbage bag, and that was just about it. So with that, we've done some digging, we put together this group. The main reason why we're coming to speak at the Human Services Board today is kind of looking through kind of the general role of these committees is partnerships with other organizations, of which this is one, and different ways that we can collaborate, advise, different things like that. So we're here kind of as partners to Human Services to see how we can work better together and to talk to the community members that are here who are in positions of being able to decide policy, to share what we've seen. So I guess we'll kind of start with that. So what have we seen so far in our years of working? So I work directly with folks in the jail and then provide some support for them when they're released.
And where the library comes in is that often people who are no longer incarcerated need somewhere to go after they have gotten out of jail. So they are waiting for a ride, or they're waiting for, they need to make a phone call, or they just really don't have anywhere to go. And as Adam mentioned about, I mean, I've seen it since I started being the librarian here, which has been about 10 years now. But people get out of jail, and I don't know if anybody's familiar about how that works, but you don't necessarily have a bag. You have your belongings. You come out with a trash bag with your stuff in it. You could have been gone to jail in the summer, and then you come out on a day like today, and you have the things that you have with you. So you have a pair of shorts and some flip-flops, no pants, no jacket. You don't have anything. And the first stop is the library. And I want you all to hear me, is that the library is a place to serve everybody. So I'm happy to have people come to the library. I've helped people who have gotten out of jail sign up for Badger Care. I've had help people develop resumes. I've had help people do lots of things. I've helped people find a ride somewhere to a shelter, and given people rides myself. But not often, it happens like quarterly maybe, is we get people who come to us in a state of crisis. So these are people who don't have anywhere to go, and they get to the library opens at 11, and they come in and they're like, I need help. And it's like, well, what can I help you with? And it's just kind of like, well, everything. So at first we didn't really know what was going on, but then we started to notice, okay, so these are people who are coming in who don't have a ride set up. And you may not know, there's no transportation in Trempealeau County. The last time I tried to get a cab, they only had one cab driver for all 5 cab companies that I called, and they were in La Crosse or Eau Claire, and they couldn't come and get somebody. And it was really cold. So we get people who are in crisis. I'll wrap this up. But the thing is, we get people in crisis. Oftentimes there are potential to become dangerous for my staff, because we're getting people who maybe were dependent on substances. There are people who are having a difficult time emotionally, and they become angry. I think about if I was dropped off in the middle of nowhere, which we're not nowhere, but we are not close to many places. And if I didn't have any money and I didn't have my phone, I would become very angry too. And I'm a moderately stable individual. So we started this group because we wanted to put together resources, and we wanted to come together and see if there are ways that we can put together resources, not just for me, because I'm just one contact point in our community. So it just happens to be the group of people who come to my building. But I know through further conversation that we have people who go to the churches in the surrounding areas. There are people who go to Quick Trip. We are sending people out the door. And this isn't necessarily just a human services problem. It's an everybody problem. And we're trying to look for ways that we can partner and provide more resources for people, so that we're not creating an atmosphere where people reoffend.
So that's kind of the basics of why we kind of brought our group together. Now we look at kind of where we're at right now. We've been meeting regularly for about 2 or 3 years. We've got members of jail and sheriff staff, Department of Corrections, so probation and parole, local interfaith groups are there, ourselves with Extension. So we've been casting a wider net, and this is part of it, is speaking with you all and seeing if this is something that you're interested in engaging with further. But the biggest thing that we're trying to do is raise that level of awareness for people. A lot of people, including myself when I started this, and probably some people in this room, generally don't think about people being released from jail every day, or some of those people. That we have a vision of our county, kind of a rural farming community. And often we don't think about that person who's walking to work as we're driving home, or who's kind of walking around the streets of Whitehall. We may have some idea or make something in our heads, but we really don't know their situation. And this is, we've kind of been able to piece together some of that and try to shine at least a little bit of light on that. And initially when people are confronted with something like that, they say, well, that's going to get real messy if I get involved with this person. They're going to want to ride, then they're going to want a place to stay, then they're going to want this, they're going to want that. And yeah, that would be a lot to ask. Yeah. And so the idea here is if we engage a lot of members in the community, all of a sudden you don't have to give a ride every day and take them to all their appointments. You're maybe just donating $10 in the donation basket at church on Sunday. And maybe that's getting somebody a backpack instead of a trash bag, and increasing kind of some of their sense of self. Maybe it's getting somebody a train ticket back to their expectant wife or partner, or some of their other kids. So it's just something to kind of consider on that level.
And to be clear, these are not people who, this doesn't happen every day, and it's not every person who gets out of jail. Many people who get out of jail have resources to call on, but there are people that are put in very hard positions.
So our work, I typically meet with people a few weeks ahead of time, kind of identify some of their needs and try to connect them with those. So working with people to get clothes, working with people to set up badger care, rides, and things like that. So that's what we've been doing, and the need. And then the question is, what do we want to keep doing? And part of that is engaging with the Human Services board here and just kind of raising that awareness, giving you more information so you can make better decisions based on kind of the needs of the county. Additionally, we're going to keep going for more programming in the jail. So if we put people in jail and nothing changes, then when they get out, nothing changes. And so by providing education, by providing and setting goals, we're setting them up with a plan rather than wishing that they're going to be different. So I don't know who dictates it, but I see that Deb's got it.
I want to call on Deb. She's got a question.
Oh, I got it back.
You're on.
Okay, Deb.
Hi, I did want to comment. We've seen the same thing, and I can't tell you how many times in the last 8.5 years that we've had to give rides using our senior services van to people to Eau Claire, La Crosse. I personally have paid for hotel rooms for individuals because they got to La Crosse, but then the bus didn't go to where they were going until the next day. Because a lot of times on the interstate up by Osseo, we collect people from all over the place. And so, I've sat with individuals in my office trying to figure out how do we get bus passes out of La Crosse, Eau Claire, then how do we get them to La Crosse, Eau Claire. I've gone over to Quick Trip with individuals and purchased them lunch because they're just starving. We had one guy one day, he just needed a charger for his cell phone. He could call somebody if he could get a charger for his cell phone. So we've seen the same thing, and we've kind of done what we can. Quite frankly, there's nothing budgeted for this. There's no resources for it. And like I say, and I know other staff have paid for some things out of their own pocket too. So I appreciate your work you're doing, and I think it matches what we've been trying to do, and putting together some resources would be helpful.
So the overall plan is kind of what Deb mentions, is if we all kind of come together, then it's not just Deb trying to figure it out on her own or Amanda trying to figure it out on her own. We create an infrastructure in the county that we can send something out, have a call list where it's like, actually, we've got a lot of people who said they're willing to do a little bit sometimes. And we've got some resources stored up different places. So it's thinking ahead rather than reacting in the moment, which sometimes provides poor outcomes for people because we can't find a ride or the taxi isn't available. So if we think ahead, work with these people in the jail ahead of time when possible, we can get them set up where they needed to go. And a lot of times it's something very minor, $100 or less, that's the difference between them getting to where they need to go and getting stable, or having serious issues in housing, substance use, different things like that.
Adam? This is Sally. Could we put this on CJCC agenda?
Yeah.
Who said CNN? Yeah.
Yeah, I think that's an excellent thought. And so that's another arm for people who don't know. The CJCC is the Criminal Justice Coordinating Council. So it's bringing in all of the members who have some sort of touch point with the criminal justice system, bringing together all of their directors. So Deb would be one of them. Sally's on there as well. And it's tackling systemic issues involving criminal justice. So coordinating efforts is one of the things that they do as well, similar to this body.
Ginny?
Question, is it possible, Deb or Sally, that some ARPA funding could be used for providing support? Maybe developing some kind of programming, because I'm sure there's a strong mental health component with people exiting jail and nowhere to go.
That would be a question for Deb. Deb knows the ARPA better than I do.
Everybody and their brothers at the table. I know Adam and Amanda were recently at Exec Finance talking about ARPA funds for serious childcare needs in the county.
Yep.
So, to be honest with you, and Adam and Amanda, tell me if I'm wrong, but I don't think we're thinking millions of dollars here. I mean, I think we could find a smaller amount of money. I mean, it's a ride, it's a coat, it's a meal, it's a
a lot of
hotel.
Right, and part of it is finding a financial home for these, for the money, they're directed for these things like the code or the ride. Part of it is so I'm glad that Sally brought up the CJCC, because like I said, it really is, it's not one group or one entity that is gonna solve the problem. It's a home for the money. It is figuring out how the incarceration process works, and because you don't have your Sally and Jeannie this list in front of you, but one of the things that we intend to do is do system mapping, because as we find out, a lot of people don't know. So like the jail doesn't necessarily know how the DA's office works and what the exact steps are. And so we find common ground in understanding what everybody else is doing. And so, yeah, finding a home for these resources, finding systematically, maybe, I don't know if people in the jail if everybody can be required to make plans for their reentry for society, meet with somebody. Who do they meet with? It's all of those things. It's both system and like a financial home, just a small fund. And we've been kind of looking for ways to do that. That was long-winded, sorry. It happens sometimes, I ramble.
And I think you're right. I think the needs are simple sometimes as much as a meal or a ride. And some people, it's where do I live and how do I get for badger care because I got medications I got to get.
Right.
So I think we have to kind of focus. Are we looking at the big things? I mean, if people need badger care, we've got in our hallway, people, if they come to the window and say, I need to sign up, we've got a computer and a phone in the hallway that people could sign up. So I think, and you probably weren't even aware of that. So there's options out there. And I think the system map might help with that. But I think we want to kind of focus that this is really two parts. There's big systemic things, and then there's just short-term help people so they can get on to their next part of their life.
Right, yep.
Yeah, so I guess kind of in a closing thought, unless there's other questions, is yes, money will help, but part of this is community reentry. And in order to reenter a community, you have to be welcomed by community members. So we can give taxi rides, we can give services to folks, but the key thing is making real, meaningful human connections with some of the people that you may avoid, generally speaking, or may see as a lot of a large concern, or take up a lot of time. But there's no way that people will re-enter a community if they're not welcomed into that community. So just making sure that even if it's opening up a little bit, taking on a little bit of that, getting to know people in these situations is going to be one of the key deciders to these people's success.
Are there any other questions that anybody has about reentry and what we're doing, or comments?
I'm just going to make one last comment if nobody has any questions. For those that were at our last Human Services Board meeting, we talked about what we're trying to do in Human Services with kind of this approach with the community centers in our communities and connecting people. And I think, again, this is just another example of something that would benefit from that type of setting in each community in Trempealeau County. I see Dick's here, so I'm going to pick on him a little bit, but because Blair is one example of a community that's really working on like their Friendship First Community Center and having different events going on there and just resources. And I think those they're kind of grassroots things in each community. They don't cost a lot of money. They mostly run on volunteer time, but where it's a place in each community that people can become connected. And these are community leaders in there and are aware of resources in the community and things like that. So just kind of making that plug and that connection between how something like that can benefit even like the jail reentry program and people that are reentering. So if that makes sense. So
as you make decisions as a board, just keep in mind the group that we've been talking about today.
Yeah. Well, thank you very much for your time. We appreciate it.
Thank you.
Thank you. It's a great presentation.
And we'll provide this digitally for you.
Okay. We'll move on to number 7, Community Outreach Center presentation.
Adam and Amanda, stay put.
Sorry, I do have to go pick up our.
Did they leave?
Keep paging
they have
back.
to leave, Sally, to pick up kids.
Oh, go do.
They can rewatch maybe.
I don't have library
Yeah.
staff. I gotta go back. That's okay.
Who is?
I think, Deb, are you going to kick us off or is Sally?
I'm going to let Sally start it out. This is her idea, so I don't want to translate it and miss some really key points. And again, this is just an idea that Sally has kind of shared with Exec Finance, and I just wanted to make sure that our committee was aware of it so that we've got, you know, the right hand talking to the left hand kind of thing. So I'm going to turn it over to Sally. I got a really cool idea, and I don't want to explain it too shorthand.
Okay, thank you. When the opioid summit, the opioid settlement was announced, I thought about some of the issues that the Reentry Committee has been tackling and other things that I've been aware of through my job or interactions with people. What I did is I went to John Austin, and the chair of the county board, and told him that I would like to see the county purchase or fund a community resource center, not to be confused with the ADRC, but a outreach center where the organizations such as Independent Living Resources or Catholic Charities, any of the various organizations within the region that are getting grant money to provide services to the people in our county, but are not doing it in our county, that they would have a place where they could have an outreach office, that they could then bring in their outreach staff to provide services. Addiction treatment, the Cooley Council on Addiction Treatment, even support groups for addiction. The St. Clair's Mission, they have a medical clinic, a mobile clinic truck that I'm thinking in 2019, early 2020, that I had talked to various people, and they were bringing it into Arcadia, but I don't know the status after COVID. But basically, that this would be a one-stop that people would be able to go to access services from these agencies are providing or should be providing services to the residents of our county, and give the folks that need those services a local way to do it. As has been mentioned a few times, we don't have public transportation. We don't have the ability to people to get from, say, Whitehall to South Lacrosse to independent living resources or some of these other programs. And yet these are the people providing or should be providing the services to the residents of our county. And so having a building, I looked at the ADRC building, but I'm not hooked on, like, we don't have to do that building, but something that's right by the courthouse. So if somebody walks in the door and says, I need this kind of help, and whoever's office that shows up at first, whether it's the county clerk's office or human services or whatever door they go to first, if that person says, okay, there's actually no agency that provides that service, but if you go across the street, there is a variety of agencies there, and then they can go over there and start working on getting access to the services that they should be able to get. So it kind of dovetails with some of what we're already talking about. And initially, the idea is that, can you hear me?
Have you got a, have you got something, like a phone on? Are you on the phone?
I'm not, no.
It's like it's a feedback coming through there.
But this is how it is when all of us talk.
Yeah, it's all of us. Yeah, I think it's actually in the courthouse. Because everybody's muted except for me, Jeannie, everybody, so.
You're in the courthouse now?
No, I'm at home. What I'm saying is the
Okay.
problem is at the courthouse because your window has the eternity thing going, where you can see everything all the way into eternity. So, yeah. Were you guys able to get the gist of what I was saying?
Yes,
Yes.
I think so, Sally.
Okay, so basically wanting to use the opioid settlement money to either purchase a building or buy property and build a building or whatever it takes to create a one-stop outreach center for all these other agencies that would be able to provide assistance and information and referral, direct service, any of those types of things so that we can start getting these services to the people in our county that, one, people are already getting paid to provide to them, but two, that's right here where they need it. If you can't get a bus or we don't have buses, but if you can't get a cab ride to La Crosse to get services, then how do you continue to get that help? And especially if it's something that is not available. There's a lot of services that are not available in our county. And like I said, these agencies, they are getting grant money to provide services to us, to our residents. And because they don't have a brick and mortar office in our county, our clients are forced to go to wherever they are. And it's just a burden, and it's not easy for people to do. And I know this because of just the 10 years working as an advocate, working with victims. I know how often I try to call and get resources for them and find out that it's not available, or yeah, we can help them, but they have to come all the way to South Lacrosse. And yeah, it doesn't work. And when a person reaches out for help, sometimes coming to the courthouse and saying, I need help, that might be the last bit of energy they had, the last bit of emotional strength they had before they just give up completely. And I just think that we finally reached that point where everybody sees that we need to start finding more community-based. We shouldn't be putting the burden on any one agency to fix these things. And yet, because we're a small county with limited resources, the few organizations, the few agencies that do help people with direct service are being asked to provide everything. And it's too much to ask. And in most cases, grant funding prohibits people from providing some of these services. So that's what I'm proposing. I'm asking that the county board take the opioid settlement money and literally direct it to providing services and support in the form of an outreach center and a place where these different agencies can provide outreach services. And when they have the excuse of, well, we don't have any place to do it, when that excuse is gone, then we can hold them more accountable for what it is they're supposed to be doing and aren't. But if we can remove that obstacle, and I'll be honest, most of them are saying we'd love to, we just don't, where can we do it? You know, we have confidentiality issues, practicality issues. We aren't able to be in a building that we don't have, you know, like we have to be able to have a way to secure our files. We have to be able to stay late for people who work. My agency, what I do for a living, I have to stay late some days because my clients have to work. And when they get off work, maybe it's 4 o'clock when they, or 4:30 when they need help. And they, by then the courthouse is closing. So I wouldn't be able to use the courthouse to meet with them. And so that's why we moved out of the courthouse as an agency so that we could have a place where we could meet with people after hours when some of our clients need to meet with us. So that's the gist of it. That's what I did, and went to exec finance and basically let them know, I don't want anybody looking at this money to put highways in or any of the pet projects that seem to be popping up for the ARPA money. I just kind of want to let them know that this is an idea that I have, and it seems like it would be a good way to allow us to start addressing all of the human crises that the people in our county are facing, who are trying to get help but just can't quite get there because it's not here locally. So that's my thing.
Jeannie?
It seems reasonable, but my understanding is that money is spread out over 17 years. Isn't that correct? That's what Rick discussed with us. So it's not like we get this 200, or I can't remember what the amount is, 200,000 something?
It's like 900. We'll get an initial
Right, but
few hundred thousand. Yeah,
it comes to us over a period of 17 years in installments.
right. And that's where
Only about 700,000 after the attorneys get their cut.
right. There'll be an initial disbursement of a few $100,000, and then yes, the rest of it will be dispersed over the course of, 17 years, which that money then can be used to pay for the support of the building.
Okay.
Is the idea I had.
And I don't believe you have to worry about it going to the highway department because, as I understand it, in the settlement, that money is it's really strict where it can go. It cannot go to the highway department or something that doesn't have to do with mental health issues as a result of opioid addiction. I know that there was a lot of screw ups with the tobacco settlement within the state, and that money was usurped and put in places it shouldn't have been, but I doubt that that will happen with this settlement.
Deb, you're muted.
If I might, I couldn't understand why I didn't hear feedback. But it is getting better, so thank you for that. So Sally, are you thinking that these individuals, these agencies would have staffing there 5 days a week? Or are you thinking it would be more interim kind of staffing? And then what is your vision for who's going to coordinate all this and who's a tenant and then who isn't? And if there's a wait list for managing all those kinds of things. And then I would like to talk a little bit about the neighborhood centers that we had shared and kind of maybe we can bring that back to another meeting to kind of talk about how do we fit these pieces together. So those are my questions for you, Sally.
Right. The how it will look is not yet determined. I mean, this is, to have had a complete plan would have been premature just because, one, we only really got the notification of the settlement a few months ago. And the other thing is yes, there needs to be a lot of people that are going to be talking about it. What I do not want to see happen is it suddenly be laid at the doorstep of, for example, your agency, because you guys already have a very full plate. And I don't want to see you guys then suddenly being put in a position of having to be landlords or overseers or whatever, and that's it. Is I don't want to create an additional burden for our county employees who already have their plates full, already have enough to do. This will, the way I see it, I guess, is in having to go through corp council would certainly be to find out how that looks. But in other communities, these types of centers are formed by a not-for-profit. The local government provides the building for it. You lease it for $1 or however that works out for, it's different everywhere. And then the government provides maybe technical support or different things, but the ongoing operations of it, yeah, that would have to be looked at. Does a not-for-profit get formed? Or do we as a county say, okay, we're gonna go ahead and either form a new committee or we're gonna, something, for me to make that kind of decision really would be improper for me to just suddenly say, this is how it should look. But I want to start moving in that direction for all of the reasons that we've already heard so far. But two is making sure that everybody understands that this need exists and that we've reached the point where we need to start dealing with it. And for me, having one department oversee it, I think would require, a lot of conversations. I know that in La Crosse, they have a center, and I believe it's a not-for-profit that oversees it. And I don't even know if our county has the kind of community organization in place that they have there that probably created it. I think too many things aren't getting done in our county because we don't have the infrastructure in place in terms of organizations to do it. And, and so, yeah, I'm basically saying, okay, well, we have this money, we have either this building or we have a place like it nearby that maybe we should be looking at. So as in terms of the neighborhood centers, I feel like that's going to rely way too much on local communities to provide that. And some communities are great. They step up fantastically. Other communities don't. And I don't want to see, a situation where we have an imbalance of access to services. So how that would streamline, how that would coordinate, how it would impact, is this committee looking at using the opioid settlement money for that? I don't know. But in terms of providing treatment services, providing access to a mental health crisis drop-in center or a short-term food pantry or things like that, all of these things that are on the table, I think our county is too small to be able to expect that we would have full operating addiction treatment centers or full operating these big things that are happening in the bigger communities. But if we have a space where all of these different organizations can come together and, maybe some say, we can staff it every day. We'll have staff there every day of the week. And others say, no, we're only going to do outreach twice a week. That will be up to those organizations that decide that they want to participate and bring services in, how they want to run that. And then, there would be a question, is there going to be an intake worker at the front door who is an employee of the not-for-profit that might be formed, or do we create a position that's a county position? I don't know. So.
At the last Human Services Board meeting, I don't think we had a vote, but we had a consensus that we would look at, I think Sally's vision is a great vision. I've worked in some nonprofits in La Crosse, and I'm trying to think about how much staffing they could, they are supposed to serve, many of them are supposed to serve the surrounding counties, but that's a fraction of what they do versus full-time. But a day a week is even better than nothing, so that's an improvement. So I'm trying to figure out how do we reconcile this idea of these community centers to bring together community, to bring together multi-generational efforts, kind of like we're seeing at the Wanik Center, but even more so, versus the project like this here, where a bunch of the money goes to pay for this facility. And maybe we just have one community center. I think we should, as a committee, be clear. And Jeannie, back to who can get this money. I mean, there's other departments, not necessarily highway, but there's other departments that have been impacted by the opioid crisis besides human services. And so I think Sally is in the same way that we are. We're trying to keep those resources as close to the people in the community as possible versus putting them in, like Sally said, exec finance. I'm not going to waste time on sending out brochures and things like that. That doesn't treat people.
Right.
And so I think we're all working on that. I think exactly what that looks like, I think we need to synthesize down a little bit. And to some degree, Sally's exactly right. I mean, how much detail do you want when a lot of this is still in the air? I know that Erica and I got a mailing just today from the state DHS that they're going to have some teleconferences coming up this next week or two about this opioid money and what it can be used for. So I think there could be other parties in the county interested in it. And I truly appreciate Sally's initiative to kind of earmark it for services to individuals in need in the same way that we are. And so I think that part of our proposals, while the exact pieces of it look a little different, that general goal is exactly the same.
Right.
Maybe we could just buy the building the ADRC is in.
Well, that's what I proposed, but apparently it's
in bad shape or what?
It's in bad shape, but there are other buildings, there's other things. I mean, exec finance, if there was any pushback, it was not on the idea, it was on the building. You know, so when people were asking questions of me, what they were saying was, well, does it have to be in that building or could we put it somewhere else? So the support was there. You know, it definitely was there. And so, yeah, I went in there. I wasn't ready to go in. John told me, he put me on the agenda because I had talked to him one day after I heard it. And I said, I don't want anybody getting any ideas about hijacking this money. And this is kind of what we need here. And then he put me on the agenda and that's where I was. But yeah, so, but it feels like the support's there. And so however we make that work, the goal that I had was, and Deb and I've talked about this, the goal is that we bring direct services to the people who need it, and that the different agencies in the region who are supposed to be providing services to our residents, that they are able to do so, and that we do everything we can to remove the barriers that they're having to provide services to our residents. And I believe that if we start getting these things into place, these outreach opportunities into place for these agencies, we probably will start seeing the residents taking advantage of that, our citizens starting to access the services. And then, yeah, ideally, instead of them walking into the library and saying they need help, they could walk across the street and then get a more coordinated, multi-pronged help. And so that's my thing. And I'm sorry if I sound groggy. I have the plague, I think. So I'm on medication and sucking down tea. So.
Okay, anything else on on this one? If not,
I have nothing else.
On. We got other things. We got quite a few things to cover yet today, so move on to. Thank you, Sally. Move on to number 8, reorganization update report.
Mike, it's just a verbal report. It's real quick. We hired the supervisor last month. Julie White was one of our lead workers in behavioral health, is now going to be the supervisor. We are working on dividing up who's on what teams because we kind of took the children families unit, we're kind of splitting that in half, and then we're taking the child disability services, splitting that in half, and then we're putting in juvenile justice. So we haven't figured out the teams, and we're being very purposeful in that. I'm actually meeting individually with each staff person to find out what it is that they need, what kind of leadership do they need, what kind of support do they need, so that I can coach their supervisors and align teams with what people's needs are and what the supervisor's skill sets are. Also this week, I'm going to be asking the supervisors for some details on cases so we can start to line up too if children, families, workers serving a case and that same case is being served in birth to 3 or wherever it is, that we can start to see if we can align those. It won't be perfect, but to the degree possible, we're going to try to do that. We will be announcing the teams the end of this month. So staff have all had an opportunity for input on this, and as well as the supervisors. And then In the meantime, as of last week, we moved all the child disability services out of Erica's unit to Julie for temporary supervision. Julie's here, she's ready to go, and Erica's very deep involved in launching the new data system for behavioral health, as well as we have a CSP review coming up next month. And so with that, we took those staff and now Julie is supervising them, although Erica's providing support to Julie in the transition as well. But that will help give Erica a little bit of breathing room to do those other big projects. We're also talking to Chuck Price. Chuck has been a director at a few counties, most recently Wapaka County. He loves big, crazy ideas. And we're going to be working with him on how do we do this implementation in a way that gets that it sticks. It isn't just one more crazy idea, that it's just a new way of doing business. It's not one more thing to do. And he's got a lot of great experience with this. And so we will be working with Chuck on this as well. So wanted to give you an update on that. I'm not going to give you an update every month, but we're ready to go. We're going to be letting the teams know who they have for supervisor. Again, the end of this month, effective February 7th, because that's the beginning of a pay period. And then we'll be getting more ready to go. Erica and the unit supervisors are going to be hammering, with the lead workers, are going to be hammering out things about referrals and all that sort of stuff. I've also asked staff, as I've been meeting with them individually, what concerns do they have? If today we said, let's go, what questions do you have? What is it going to look like? So I've had some great conversations with staff. I've gotten really excellent feedback on my picture of how this is going to go. And so they've really been very helpful, and we need to keep on doing that. So that's just a quick update. I just want to let you know we're proceeding with it, but we're proceeding very purposefully and very as smart as we can. We want everybody's buy-in on this. And so I think I've gotten really positive feedback from staff on this as well. And I don't know if anybody has any questions. That's all I've got on this one.
On to 8521 plan approval.
Yes. So I'm here to talk about transportation for the elderly and disabled in our county. And so specifically, I'm here to talk about Wisconsin Statute 8521, which is the Specialized Transportation Assistance Program for counties. So we are told by the state what our allocation is going to be for that program. And what they have indicated this year, we are allocated for $79,889. We are required to do a local match of 20% for transportation, which is $15,978. So again, the state tells us what we are allocated, and then we have to do a local match. So we need to tell the state what we are going to use these funds for. So this isn't something new. This is something that we've done in the past. And what I am proposing is that we would use the funds to again to help operate our vehicles and reimburse drivers for those two populations, again, the elderly and disabled. As required, we did have a public hearing that was held last Monday. I do want to report that we did not have any persons attend the hearing, but I did have 2 people from the community that were unable to attend the hearing that did call me to provide input. Just to briefly tell you what they had to say, we had one consumer that was wanting us to provide local grocery pickup. And so what I did explain was that that is something that we are already providing for our local transportation. We had another consumer that suggests we provide transportation to our commodity food pantry distribution, which is held one time a month in rural Whitehall. That is something that the ADRC has provided in the past. We are not currently providing it, but I do feel that if there is a need, that is certainly something that we could resume. So that is something that I do plan to, explore and will look into providing if there is interest. So one of the other pieces to the application is, and we've reported in recent months that we do have some trust funds. The state also wants to know how we plan to spend our trust funds. And so what we are proposing is to use some of the funds from our trust fund to purchase the new vehicle that had been approved by the board. I believe it was just in the most recent meeting. Yeah. In December
And the
of 21.
Claire, trust fund sounds like this cool thing, doesn't it? Like a nice slush fund. It's not that cool at all. It's funds that were unspent. If we spend, we have that 79,000, and then we have to put in match. And if we don't spend the full match, that goes into the trust fund. We have to set that aside just specifically for transportation. So this is from unspent funds from previous years, and it's a number of previous years. So just so you're aware where this has come from, this isn't like a slush fund or something cool. Trust fund just kind of makes it sound more interesting than it really is. So I just wanted to be really clear for the public what that is.
Yeah, thank you, Deb. So again, we need to, tell the state how we plan to use the funds. And again, just to review quickly, it is to operate our two programs, the bus service, which we have talked about in the past. The bus service typically is taking groups of elderly or disabled individuals then to Eau Claire. We have trips currently running to Eau Claire, La Crosse, and Black River Falls. And it's also to operate our local van transportation. These priorities for these, both of the bus service and the local van transportation priorities include trips for medical, nutrition, business, and social trips. So that's exactly what the plan would be for these funds. So at this point, what I'm, asking is if anybody has any questions or feedback regarding these funds. And ultimately then would need to have Human Services Board approval to submit this plan to the state. So does anybody have any questions or feedback?
I just have one question.
Yes.
When you talked about you had a resident that asked about the grocery pickup.
Mm-hmm.
Are you meaning grocery in the sense that they physically have to go there to pick up their groceries, or you will pick up their grocery bags prepaid
We can do
deliver
both.
to their door?
Yep, we can do both. And really, when COVID occurred, that program did expand because certainly people were not able to get out and about. So really, we can do either one of those. And that's what I explained to that individual as well.
Are you limited by location?
We are limited by location. The way that we are currently operating is that, again, we keep it local. So these are trips that are done in our county. So for example, the person that I spoke to was from Trempealeau. There is not a grocery store in Trempealeau. So if somebody from Trempealeau does contact us, the options that we would provide would be one, the bus service. So that person could be picked up at their home and taken to La Crosse. That would be the closest place, so that we would be able to take them to La Crosse to purchase groceries on their own. Otherwise, we would be looking and having a discussion about what their preference would be and what exactly where their location is in Trempealeau. But we would provide then options for pickup in either Galesville, where there is the closest grocery store, or in Arcadia. So it isn't, and so each community is a little bit different. So for example, in Whitehall, there is a grocery store. We would do groceries in our community. So it's kind of a little bit different, but we do keep it local in our county and as close to the grocery store as we can for each community. So we would not take somebody from Whitehall, for example, to Osseo, but we provide it, that service throughout the entire county.
Thank you.
I think it is a matter of, it's just continuing to get the word out because that individual just wasn't aware of the services we provide.
Melissa, are you looking to change anything fundamentally on the 8521 plan from 2022 as compared to previous years?
No, not at all. The only thing is, like I said, in the past, we have, the one person specifically wanted that food pantry that occurs on a Saturday. We currently don't have a plan to provide that. But again, if there is a need, we would certainly explore meeting that need, whether it be volunteers or whether it be one of our drivers. I think ideally, we would look for volunteers, and I want to explore too if the food pantry has any delivery options, which I don't know. Actually, just talked to the lady, the consumer today. Does anybody else have any questions?
Erica, did we used to provide service to food pantries in the past? For some reason, it sounds familiar.
We do, and I would say we still do. I think specifically, I know exactly what the request is because we had started this service pre-COVID in picking people up specifically for the Trempealeau County Food Pantry, which serves the entire county. So each community has their own food pantry as well. And so we have and continue to provide local transport to their food pantry in their hometown. The Trempealeau County one, what happened was we started that service and started offering it, but it wasn't being utilized, particularly during COVID. So the cost of running a bus and running it all over the county to pick people up really just wasn't an efficient use of that resource. And during COVID, people weren't really going to the food pantry. I think there was more pickups and things like that being arranged. So we just kind of chose to discontinue that service. And again, if the need is there and it makes good, I think, efficient use of the resources that we have, I don't think we're opposed to that. It's just, to pick up a bus and have a driver go out on a Saturday that we're paying to pick up one or two people. I'm not sure if that's real efficient use of our funds when they do have that option in their own community. So.
Yeah, that is very accurate, Erica, because we do, just to answer your question, we do provide transportation to all of the food pantries in the county. So again, we kind of, keeping it local, so persons from Whitehall, that's where we would take them, we would provide transportation to and from the Whitehall food pantry. But, so, yep, that's very accurate.
If there isn't any more questions, I would look for a motion to approve.
So Kurt, would you looking for a
To
motion?
approve the plan? Oh, I'll make a motion to approve the 8521 plan as presented by Melissa Youngbauer.
I'll second.
Second? Bridget? Okay, a motion and a second. All those in favor signify by saying aye.
Aye.
Opposed, same sign. All right, carried.
Thank you.
Okay, we'll move on to the 2022 rate setting. Is that you, Deb?
I'm going to turn this over to Victoria. I do want to say that this is a policy that has to come before you every year for you to approve our updated rates. And so if you've seen this before and you're like, why are we looking at this again? You have to look at it every year by statute. So Victoria's done a lot of work on this, as well as the next agenda item on the credit card policy. So I'm going to turn it over to her.
Thank you, Deb. So yes, I am here today just to present to you the new updated fee charging policy for 2022. And as you can see, it is very similar to 2021. There were a few areas where the rates have changed. Under case management, the rate went from $106.20 to $109.44. The birth to 3 therapy, that rate increased $1, so it went from $79 an hour to $80. And then the other change on here is we added in the cost associated with hard copies for black and white copies and color copies. So black and white, as you can see, it's at $10 or 10 cents per page, and color copies are at 15 cents per page. So those are the changes noted in the 2022 fee charging policy.
All these fees are established based, using state formulas and are based on our actual expenses. So we would need this policy approved, unless there's questions.
So we want an approval of the rate setting for 2022, is that right?
Yes, that is correct.
Okay. Everybody understand the new rate setting?
Oh, I'm sorry.
Go ahead.
I just was going to move to approve the rates
Okay.
for
Motion.
2022.
Motion by Jeannie. Second?
I'll second it.
Second by Dora. Okay, all those in favor of the new rate setting approval signify by saying aye.
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 Opposed? Same sign. Okay, carried. Approve Human Services credit card policy.
Hi.
Victoria again.
Oh, Victoria?
Yes, thank you. So we created the Human Services credit card policy that you can see for your review. The Trempealeau County has a credit card policy in whole, and I thought it was important that we have one specific for the Human Services Department to outline some more policy or procedural stuff to kind of keep it very secure. So this policy really limits on who's using the credit card and how approvals are made. So you can see there's the authorization form, authorization for Human Services credit card form, that we are currently using this, and a lot of these procedures are already in place. It was just really important to have them documented for our department. So one of the changes we noted in the Human Services credit card authorization form was making sure that we have dual signatures on it. And in the policy itself, it's limiting on who's doing the purchases, so that, the people that are approving the credit cards bills are not the people doing the purchases. So just making sure to keep everything very separate and just good controls on that. So that we felt that it was really important to get that documented. So anything additional that you'd like to add, Deb?
No, I think you did a great job. And I think your point about, really looking at these internal controls, we as a county overall haven't been great at them, but I appreciate the work you're doing. Again, the person who sends the bills should not be the person receiving money in the same way the person that processes payments of invoices should not be the person doing the purchasing. And so this policy will also help address that, but it's also just provides a lot of clarity for staff and the safeguards that we really need. And the other thing Victoria's really working hard on is we use this credit card pretty easily. Anytime you could pay for something with a credit card, we just did. And that can really create some issues because we have proper purchasing procedures. We have when you request to get a bill paid, you have to have you have to request it. Your supervisor has to sign off on it. Two people in finance look at it. I look at it. But if you buy something on a credit card, it's just you and the person with the credit card, and that seems to not be the best policy. So this is tightening that up, and then it's also helping really reinforce our regular payment system. And I appreciate Victoria's work on this. Thank you.
Thank you, Deb.
Thank you, Victoria. Yeah, I'm just giving them a chance to read.
Digest.
Okay, Bridget?
I'll make a motion to approve the Human Services credit card policy.
Okay. Second to that?
I'll second.
Second by Karen. Motion by Bridget and second by Karen to approve the Human Services credit card policy. All those in favor signify by saying aye.
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 Opposed, same sign. Passed. Thank you. Good job.
Thank you.
Okay, move on to the 2018-2021 strategic plan update.
So our strategic plan technically expired 12/31. So we should be working on a new strategic plan. However, bear in mind, we are working with two excellent consultants on really helping strengthen our department after last summer's events. And we are in the middle of a reorganization. As you heard today, there are two ideas that we need to meld together on how do we do community services and request the opioid funds. And even from Adam, you heard, and Amanda, you heard about community needs. And then you heard a great report from Melissa. She's done great work on resources we have that people don't know about. So what I would request from you is that we have a lot of things in the air right now, and to create a new strategic plan at this time would be premature. And so if we can spend 2022 getting those items settled, and at the end of 22 start working on a new strategic plan, I think that would make a lot more sense. I think the timing makes more sense. So I would be asking that you approve extending this strategic plan through 2022. I'm sure you have questions, but that is kind of what the proposal is.
Any questions? I would look for a motion to extend the plan through 2022.
I'll move we extend the current strategic plan through 2022.
Motion and a second? Who seconded? Okay, Diane. Okay. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay, thank you. Move on to the adult service numbers for representation.
That's me.
By the way, I just want to say thank you. Yeah, I'm going to do an introduction if you don't mind, Erica. And I also want to say thank you on the strategic plan. It might not seem like as big a deal for you, but I was just, we owe you a strategic plan. We owe the community a strategic plan, but I was just like, oh, how do I do that inside of everything else? So I genuinely appreciate you giving us this year to really take care of some, as Sally said earlier, we've got some really big things on our plate and we want to make those happen. Recently the Corporation Council talked with Exec Finance about need for additional staffing in their office, and referenced in part some of the growth in our department as the substantiation for that. And so I did come back and talk to our staff because I want to be, again, the Corporation Council office needs to do what they need to do, and this is no reflection on it. It's just that this conversation started, so I want to, we haven't asked for any extra staff. And so why are they, they need to ask for the staff they need, and that we were only part of why they were requesting additional staffing. But I wanted to give you a report on where those numbers are. And I think Erica and her staff have pulled that together. So I just want to turn it over to her and just so you understand the context of why you have this.
Yeah, so I handed out the report, which is our adult services requiring representation report. So what does that mean? That just means these are just the adult services that require Corporation Council services or attorney services to represent us in the court process. So those involve Chapter 55 protective placements and Chapter 54 guardianship cases, which generally are lumped together because to have a protective placement, you have to have a guardianship. So those kind of run hand in hand. And then, of course, our emergency detentions. So emergency detentions require a 72-hour response, to have a probable cause hearing, and then a follow-up final hearing if the court deems that necessary. And then I also just put our Chapter 51 commitments. So those are people that are already on a Chapter 51 commitment, and then annually, at least annually, we have to go through a review process that requires representation in court as well. So I'll kind of go over the report, and then if you have questions, please feel free to ask. So I did kind of a 5-year summary on the numbers, and you can kind of just see. So I put the actual numbers in the tables for you, and then I kind of did a graph so you could see the growth. We have seen some significant growth just this year, in particular in our protective placement and guardianship cases.
we were averaging kind of more in the mid-20s and then jumped up to 36 in 2021. As far as emergency detentions go, we're actually a little bit lower in 2021 than we have been the past, I guess the year prior. So really, we haven't seen, when we look at like long-term averages of emergency detentions, we don't see, it's a little bit of a roller coaster, but it's fairly predictable. It goes up a little bit, it goes down a little bit, it goes up a little bit, it goes down a little bit. Where we have seen some significant changes in the number of commitments that are being held at one period of time, and that is due to changes in the law. It is much more difficult, I'm not saying that's a good thing or a bad thing, to keep people on commitment for long periods of time. So back in 2017, we had 53 people, Trempealeau County residents, on a Chapter 51 commitment that was supervised by our county. And as of 2021, we are down to 38. I believe, and that's an average. We're actually, as of December 31st, significantly even below that 38 number. And again, that's not really due to any opinion or that we have in our department. It is the legal requirements required by the law set forth in court. So I just kind of, as far as the mental health system goes, we're not seeing a big increase in emergency detentions. We are seeing a significant decrease in the number of commitments that we're monitoring. However, we did see somewhat of a significant increase in protective placement and guardianships in 2021. So with that, I guess, do people have questions or want some further clarification on any of that?
I just wanted, in case the question came back to on if these numbers are going up, why isn't Human Services adding staff? I mean, not that people are asking us to add staff, but I just wanted you to know we feel that we're adequately staffed to continue serving people with these needs. And so I just wanted to give you an update on that. So in case there's any questions. I think you'll be hearing more about this in the future through the committees and the county board. So I just wanted to give you some information for background on that. So that's all that is. If you don't mind, Kirk, I'll go on to the personnel report.
Deb.
Okay. So for the personnel report, we filled the ADRC administrative position. Sammy is sitting there with Sam, so it's going to be very confusing to me for a while, but we'll figure it out. So welcome, Sammy. And we had a vacancy in economic support, and we had another vacancy last week. And so we did do interviews last week, so we're hoping we can maybe get 2 candidates out of that pool, and we can refill those positions pretty quickly. Last week, I think it was, we have a vacancy in children and families. We haven't received a lot of applications in that area. We've been struggling a little bit with that. Don't know why, but we did do some interviews last week and the week before, so we're hoping we can have an offer going out soon on that one. And then the only position that's left to post is we have a CCS social worker opening, and so we'll be getting that posted through HR this week. They've been working with us on making sure the job description's up to date and all those sorts of things. And I think that takes care of all the vacancies. So we had kind of a lot going on for a while this summer. That has really slowed down, and I'm grateful for that, and I hope it stays at that.
Okay. Any questions on the personnel report? If not, we'll move on to the financial report.
Financial report you have is through October. The bottom line is we are hanging on in the black. That's a positive thing. We've had a lot more placements in adult services this year than we've seen in a long time. We've talked with you before about in large part how COVID has really caused people when they've lost out on those natural supports and those connections to the natural supports, they've really struggled. And so we've seen some increased needs for services there. But overall, we are doing okay. Actually, might be doing a little bit better than this. We are, Victoria and Christy and Sam and Mary and Sammy are going to do a lot of work. We got a little bit behind on some of our billing, so we're getting caught up on that. Some of our home delivered meal and some of our transportation billing has been a little delayed. And so I think we might have some additional revenues coming in. It's not going to be substantial, but it will certainly have a positive impact. The other thing I want to tell you is that every year we do this thing called WMCR, and it's a money laundering scheme. It stands for, I don't know what it stands for, but it's services that MA funds used to pay us for. So it's for CCS case management, CSP case management, birth to 3 case management. So we bill MA and they pay us back for those services. So the state of Wisconsin figured out, oh gosh, probably 15, 20 years ago, that if they have counties submit all this detail at the end of the year about what it actually costs them to deliver that service, we can then send it into the feds and get some additional federal dollars. The state keeps some and we keep some. So Trempealeau County overall has never made much money on that. But I think we budget for around $10,000 or $7,500, and we did collect in the CSP and the birth to 3 portion over $30,000. So that's coming in the end of the year. So it's not in this report, but that will be a positive for us. The other piece is that in the CCS program, we have ended up having to owe money, and I've talked with. It's been a couple of years, but I've talked to this board about that issue, and we've actually had a resolution. We set up a non-lapsing account so that when we had some money, we could put in there so that it could pay for those recoupments that the state was going to come and get. So at the end of the 2020 year, we actually are going to be receiving some additional funding through WMCR for CCS. So that's the first time ever. We're pretty excited. It's been a lot of work done by the fiscal unit and the behavioral health unit, and huge thank yous to all those staff that made this happen. We changed how we did our billing. Erica and her staff have been very careful about how they track details of things. So that's a lot of money. Again, we have to look at how much of that has to go towards paying off some of our previous recoupment. But that is good news. It's the first time I've had good news in WMCR in years here, so I'm pretty excited about that. So we're doing okay. The bottom line, again, we're hanging on pretty tight by 0.5%. That's pretty close to the margin. And so we're still hoping we can end the year with a positive. There's a lot of November, December bills still coming in, some of the placement bills. So it'll be a mad rush these next couple months to really figure out exactly how we land on this. But in a bad year, we still are hoping that we can land in the black. So that's a positive, and a lot of work by a lot of people to make that happen. I also just want to say a shout out to all the supervisors that are there at the meeting today. I know Julie and Aaron aren't there, and Sandy and Dana. Sandy and Dana spoke at your last meeting. But we've just got such a good supervisory team, and the fact that I can't be in the building and these folks are rocking it with great reports. I just want to say thank you to Erica and Melissa and Victoria for your great work. So thank you for that.
Okay. Any questions of Deb? Not. Thank you, Deb. And we'll move on to the next meeting date. It's the 7th of February, if that's what everybody else has got.
Valentine's Day, the 14th.
Oh, okay, yeah, Mondays. That would be the first. That would be the first Monday. Sorry. Okay.
So we will all be each other's sweethearts here, and we'll get together on Valentine's Day.
Yeah. Okay, with that, we'll adjourn the meeting at 5:30. Thank you, everyone.
Thank you, everybody. Thank you.